Picture this. Your patient just got difficult news. Their heart is racing, their breathing is shallow, and fear is taking over. In that moment, you are more than a caregiver. You are a coach who can help them find calm again. That skill is called teaching emotional regulation, and it might be one of the most powerful tools you carry into any room. Let's break it down together. What is emotional regulation? Emotional regulation is the ability to recognize, understand, and manage strong feelings in a healthy way. It does not mean shutting emotions off. It means responding to them with intention instead of reacting on impulse. When you teach emotional regulation, you give patients simple tools to steady themselves. You help them move from panic to control, one small step at a time. Why it matters in nursing here is why this skill deserves your attention. Strong emotions affect the body. Fear and anxiety can raise blood pressure, speed up heart rate, and make pain feel worse. When patients regulate their emotions, their bodies often follow. Emotional regulation supports 1. Better pain management. 2. Improved treatment cooperation. 3. Faster recovery and lower stress. And stronger trust between you and your patient. And it is not just for patients. These same tools help you stay grounded during a demanding shift. Key strategies you can teach. Let's walk through 4 practical strategies. Each one is easy to teach at the bedside. 1. Deep breathing. Guide your patient through slow, controlled breaths. Try the 4-7-8 method. Inhale for 4 counts, hold for 7, exhale for 8. This activates the body's natural calming response. 2. Cognitive reframing. Help patients shift how they view a stressful thought. Instead of, "I can't handle this," guide them toward, "I am taking this one step at a time." A new perspective can lower fear fast. 3. Grounding techniques. When a patient feels overwhelmed, bring them back to the present. Try the 5-4-3-2-1 method. Name 5 things you see, 4 you can touch, 3 you hear, 2 you smell, and 1 you taste. 4. Identifying triggers. Teach patients to notice what sparks their stress. Once they name the trigger, they can prepare for it and respond with a plan. Real-world clinical scenarios. Let's see these tools in action. Scenario 1. A pre-op patient is trembling with anxiety. You sit beside them and guide slow breathing. Within minutes, their shoulders drop and their breathing evens out. They walk into surgery feeling more in control. Scenario 2. A patient with a new diagnosis keeps repeating, "My life is over." You gently offer reframing. Together, you focus on the next appointment, the next step, the next small win. Hope returns. Scenario 3. A patient in the ED spirals into a panic attack. You use grounding. You ask them to name what they see and feel in the room. Slowly, they reconnect with the present moment. These moments do not require fancy equipment. They require presence, patience, and a few simple techniques. Bringing it all together. Teaching emotional regulation transforms patient care. It builds trust, eases suffering, and empowers people to face hard moments with courage. And every time you use these tools, you grow as a clinician too. Keep growing with Elite Learning. Ready to strengthen your skills even further? At elitelearning.com, you'll find flexible continuing education built for busy nurses. Learn at your own pace, anytime, anywhere. From evidence-based courses to expert instructors, Elite Learning helps you deliver confident, compassionate care. You have the power to change how patients experience their hardest moments. Keep learning, keep growing, and keep making a difference. Visit elitelearning.com today and take the next step in your nursing journey.